So some interesting information just came out of the European Association of Urologists. In their meeting in Barcelona, Spain, March 18th, 2019, some fellows from a New York institution covered a study that they had done, basically looking at men whose PSA tests were high enough to indicate a need for a prostate biopsy. So what they did was they had those men go back home for 2 months, stop eating spicy food, stop bicycle riding, stop coffee drinking, and stop alcohol. When they came back, over half of those men really no longer had the indication for a prostate biopsy. I tell you what, I think I would stop those 4 to avoid a prostate biopsy. This was 8 weeks. And again, they're not saying you have to stop it permanently. They're saying, look, in order to make sure that your test is low enough, you need to make these changes. Now, how do you interpret that? We'll get into that in just a minute. How strong is the evidence? Again, it's not a huge study. But I agree with the author of the study when he said, look, this is it's not a huge study, but it's a big enough deal to where it's worth taking a look at the signals that we're getting from this study. It was, again, Barcelona, Spain. It was covered in Medscape News. The author was Alexander Zlotta, director of the Uro-Oncology unit at Mount Sinai Hospital and professor of surgery, urological surgery, at Toronto, Ontario, in Canada. Now, basically he said, spicy food induces inflammation. Inflammation directly translates into an increase in PSA. This is just food for thought, pardon the pun, I guess. It's by no means definitive, and we're going to embark on a randomized study to test this further. But I think this study signal is strong enough and robust enough that we should at least pay attention to what's going on here. He explained that repeat biopsy decisions are not based on a single PSA, but that the new intervention might be a good idea before repeating a PSA test. Although PSA is fairly sensitive for prostatic enlargement, it's got poor specificity for prostatic cancer. In other words, a lot of things. When you have that situation where it's sensitive but poor specificity, it means it's sort of like C-reactive protein for heart attack and stroke. Yes, you can get an elevation. It's fairly sensitive, but a lot of things can cause elevation. With CRP, things like getting a flu shot can cause elevation. With prostatic specific antigen, things like spicy food, bike riding, alcohol, and coffee can cause an increase in PSA. So what was the study, and how did they do it? What did it look like? To see whether specific lifestyle changes could modify serum PSA levels in men from levels 2 to 10 nanograms per milliliter in a normal digital rectal exam, the authors conducted a retrospective study, 189 men. The sample included 67 men who adopted the lifestyle changes and 122 men who did not. Men with suspicious digital rectal exam or who were taking 5-alpha reductase inhibitors were excluded from the study. The lifestyle intervention involved, as we said, abstinence from spicy foods, alcohol, caffeine, and bike riding for a minimum of 8 weeks before the repeat PSA testing. There were no significant differences at baseline between the intervention and control groups. In family history of prostate, age, the median age was 59 in the study group versus 60 in the control. Median prostate volume, 42 versus 46 in the control. Median total PSA values, 5.2 versus 5.68 in the controls. And median free to total PSA ratio values, 0.16 versus 0.15. The authors found that in the lifestyle modification group, those in the lifestyle modification group had significantly lower PSA on repeat testing after a median of 8 weeks of lifestyle changes from the first test. 3.5 versus 5.09 nanograms. In other words, the average for the study group was 5.09 at the first test, and doing these lifestyle changes, it dropped it to 3.5, as well as a greater decrease from baseline in total PSA, 1.38 versus 0.44. In other words, a significant decrease. In addition, a higher proportion of men in the intervention group were spared from biopsy. Although that was the case, here's an interesting twist. Prostatic cancer detection rates were actually higher in the lifestyle modification group, 13.4% versus 7.4%. Now, what does that mean? Does that mean that one or a group of these exposures were actually causing the problem in the first place and went on to form cancer? It's way too early to make those kind of leaps of logic, but it's an interesting question. In multivariable analysis, which was, in other words, adjusted for age, prostatic volume, free to total PSA ratio, and lifestyle modification, PSA at baseline, I'm sorry, in the multivariate analysis adjusted for those items, lifestyle modification and PSA at baseline were independent predictors for subsequent PSA declines. In other words, if you did the lifestyle modification, it was a predictor that you would drop your PSA. If you had a really high PSA, excuse me, that also predicted that it would drop. Again, both of these interesting to know and maybe not so surprising. In 31 of the 67 men in the intervention group, PSA levels declined to below the minimum level that would signal a biopsy was warranted. So again, very, very interesting study. Way too early to make huge conclusions off of this, but something to think about. It certainly got the attention of a lot of urologists, and you'll probably be hearing more from this. Again, in terms of hearing more, if you've already made it this far, thanks for your interest.